Blessing Health System is proud to announce the addition of new surgical services, including plastic and reconstructive surgery, as well as pediatric plastic surgery. I'm Laura Wheatholder. I'm a registered nurse and community outreach coordinator for Blessing Health System. I'm joined today by Dr. Ashard Muzaffar, who we're going to get to know a little bit better. Thank you for joining me. Can you please take a moment to introduce yourself?
Sure. Yeah, I'm Arshad Muzaffar, and I'm a plastic surgeon here at Blessing Health System. And I'm board certified in plastic surgery and also fellowship trained in craniofacial surgery and hand surgery. And I spent the last 16 years at the University of Missouri and four and a half years at the University of Washington before that. And have recently started here at Blessing and excited to have a comprehensive and robust plastic surgery service here.
Well, thank you so much for joining me today and welcome to the health system.
Thank you.
You touched a little bit on your background, but what brought you to Quincy? What and brought you to this area?
Well, there's an opportunity here to build a plastic surgery program essentially from scratch. And I've spent much of my career building programs and teams. So the opportunity to kind of establish something in a vibrant and very rapidly growing health system was very appealing to me. Also, the opportunity to bring services to the community that have not been available to much of an extent in the past, like some of the pediatric plastic surgery, craniofacial, pediatric hand things that we do, as well as the more common plastic surgery procedures in the cosmetic realm and so forth.
Well, we are so excited to have you here, and you touched on it a little bit. I want to go a little bit more in depth, but you specialize in adult and pediatric plastic surgery. Now, there's some people who might just think plastic surgery, cosmetic procedures, but you mentioned some of the non-elective procedures, including the pediatric craniofacial procedures. Explain a little bit about those. What are they? What's the goal? With that type of surgery, and who might benefit?
Sure. Pediatric craniofacial surgery relates to any sort of birth anomalies or differences of the head and face. And the most common example would be cleft lip and palate. That's probably the thing that most people would be familiar with. That's an extremely common birth anomaly, about 1 in 600 live births in the United States. It's similar in incidence to Down syndrome, for example. So quite common. And, there's a host of other diagnoses and problems. For example, children with abnormal head shapes, which can be caused by abnormal development of the bones of the skull, all sorts of different things. But a pediatric craniofacial surgeon is trained to deal with all of those sorts of things. So, and we see those patients anywhere from birth. Actually, some often we'll counsel the patients prenatally if a diagnosis is made prenatally. So we'll see the family even before the child is born, and then all the way into adulthood. So many of our patients we see for years and years and have a long-term ongoing established relationship with them and the family throughout the course of their treatment.
And this is for Blessing, a new service that we're offering. So we're really excited that you were able to bring that to our community. What inspired you to specialize in that type of pediatric procedure?
Well, the first thing that caught my attention and inspired me to learn more about it was seeing in medical school, seeing photographs of patients with cleft lip and palate before and after surgery, and the transformation really sparked my imagination. I found it to be just remarkable, the change that could be wrought by a surgical procedure like a cleft lip repair. And so that spurred me to learn more about plastic surgery. And from there, my interest developed further. And here I am.
I imagine for those patients and those families, it can be life changing, that type of surgery, especially cleft lip and cleft palate, because it's not just a cosmetic issue for many of those patients.
No, absolutely not. It is reconstructive surgery. Um, and it is life changing. I mean, those children, what we do in that first operation when they're a few months old will dramatically impact the rest of their life. And so that getting that first operation right and doing it well is critical. I mean, there's no no amount of revising. We can always make things better with revisions, and I've done a lot of secondary surgery on patients who've been treated elsewhere and by other surgeons, but there's no substitute for getting that first operation right.
Well, again, we're so excited to be able to offer that to patients in the area now. Now, you also specialize in elective procedures, and you touched on that a little bit, including cosmetic and aesthetic procedures. I'm sure you get a lot of questions about the cosmetic procedures. So, what would you tell anyone who's maybe considering that type of procedure?
Well, I mean, cosmetic surgery spans the gamut from facial to breast and body contouring surgery. And I think the first thing to remember is that it's still surgery. And there, it's real surgery with real potential risks and complications. So it's important for the surgeon to be a good doctor first and make sure that he or she assesses the whole patient, make sure that we're making good surgical decisions for the patients, taking their overall health and well-being in to account. That's the first thing. And then just, making sure that we get on the same page with the patient, that we understand what's bothering the patient, why they're here talking to us, what their motivation is, what their expectations are. Um, that understanding between the patient and the surgeon is critical to getting good outcomes and happy patients in aesthetic surgery, in particular, because in the case of aesthetic surgery, you're starting out with something where there's not a wound or a defect or a deformity. You're trying to enhance something that is otherwise technically normal. And that is so intricately tied into a patient's sense of self and well-being and self-esteem. So for us to provide the patient what she or he wants, we really need to understand them, completely to be able to give them what they want, what they're looking for.
I talk with a lot of physicians and nurse practitioners, and the theme that I see that comes along with all of these sessions is personalized one-on-one care. So I imagine that is really important for you in all aspects, but especially when it comes to those aesthetic procedures, making sure you understand the patient, what they want, their goals, and those type of things.
Yes, absolutely. No two patients are going to be exactly the same. Their motivations, their image of themselves, all of that's going to be different. And so we need to be able to establish that connection with the patient that allows us to understand what they want, for them to feel comfortable with telling us exactly what they want, and making sure that they know that I understand them, and vice versa. So that really is critical.
And now you specialize in a wide variety of these types of procedures. I saw the list and it's very comprehensive. Um, can you talk a little bit about just the variety of aesthetic services that are available through your office now?
Sure. In broad categories, aesthetic surgery is generally broken down into facial aesthetic surgery and then breast and body contouring surgery. And then in another way, categorized into surgical and non-surgical treatments. So, and being a craniofacial surgeon, of course, I have a special interest in facial aesthetic surgery, especially rhinoplasty or nasal surgery, both functional and aesthetic. And I have lots of experience with that, and published lots of papers and book chapters on rhinoplasty. So that's a really special area of interest of mine. But I do the entire gamut of facial aesthetic surgery, as well as breast and body contouring. So rhinoplasty, facelifts, neck lifts, brow lifts, eyelid surgery, breast lifts, breast augmentation, tummy tucks, liposuction, um, the whole gamut of body contouring, massive weight loss patients who need, excess skin and soft tissue removed, those kinds of things as well. So really, it's a very broad spectrum.
So I think probably the suggestion would be if you've thought about something or you're considering something, definitely give your office a call because there's a chance that it's probably something that you can assist them with or at least kind of talk them through.
Yes, absolutely. Yeah, there's almost nothing that we don't do. I mean, fortunately, my training is broad enough, both in general plastic surgery, aesthetic surgery, craniofacial surgery, hand surgery, that there's not much in the realm of plastic surgery that we don't address.
Now, switching gears just a bit, and we touched on this before with the reconstructive surgery, it can do so much for patients who've experienced maybe trauma or have a congenital condition. Can you talk a little bit about how reconstructive surgeries can benefit a person and perhaps restore function? Because that's an important part of that type of surgery.
Certainly, yes. Reconstructive surgery really, by definition, is to take something and restore it to its former normal state. So, whether that is dealing with something that's been disturbed by cancer or tumor or trauma or an acquired deformity over time, like arthritis or anything like of that nature, those all fall into the reconstructive category. And very often we're dealing with both form and function, not just the appearance. Hand surgery is a perfect example. Form and function are tied together intimately in hand surgery. But much of what we do also is functionally significant. Breast reconstruction, head and neck reconstruction for cancer, trauma reconstruction after motor vehicle collisions, whether it's facial trauma or lower extremity trauma, helping the orthopedic surgeons if they have lower extremity trauma with wounds that need coverage and so forth. Um, Really, plastic surgery has such a broad reach and touches almost all surgical specialties. We are often called upon to assist virtually all of our surgical subspecialty colleagues at some point for a reconstructive problem. And we're often the last resort when things aren't working. We're called upon to try to fix the problem.
Okay. Now, is there anything, we covered a lot today. Is there anything else that you would like your patients to know about you or your practice? Anything that we might have missed?
Well, I think you've done a fantastic job covering everything, but I would say that we have a team approach, and we have an excellent team here. My nurse, Lynette Baker, has worked with me for the last 16 years, and so we have a very good team approach. But the rest of our clinical staff and our entire staff here in the plastic surgery office is fantastic. So I think patients would would have a very good experience. We've got a great group of people, and it's definitely a team approach. It's not just the doctor or the surgeon, but the whole team.
Well, thank you so much for joining us today. Welcome to the health system. We're so glad to have you here. And you can learn more about Dr. Muzaffar and the many services he offers on our website, blessinghealth.org/plastic and reconstructive surgery. Thank you again for joining me.
Thank you so much.